Hi, Dennis. Hi, everyone. I'm very pleased and a little bit excited to talk to you today about health economic, and why is it also an important topic for us at WifOR for our research work. So, Dennis, I think I have a good master plan for our talk right now. Let's see how it works. So I'd like to talk with you about three main topics. First of all, I think we should start with the paradigm shift in health, away from a cost factor towards an investment point of view. Secondly, the return on invest of health investments, how we can measure it and why it is important. And thirdly, some use cases and best practice. Who is going to use such metrics and probably why are they going to use it? Okay, let's start it. Then it's right now everyone is talking about health policy, but also about health economy and its consequences. In the recent years, we have all felt it in multiple ways, not only because of Corona, but about of everything and how important health is for all of us and how many areas of our lives is or have been affected by health and health decision and health policy. Right now at the UN Climate Change Conference, also health is a huge topic, an important topic to see the interdependencies between climate and health and stuff like that. And of course, the WHO and Dr. Tedros said a few years ago, I'm not sure, the time has come for a new narrative that sees health not as a cost, but an investment that is a foundation of a productive, resilient, and stable economies. So we see health topics are everywhere. And now the first question from my side to you is, what is health and above all, health economy for you? So tell us a little bit about your health journey at WifOR, how it began and where we are right now.
Thank you so much, Sandra. And once again, Danny, thank you for the lovely introduction. It's great to have you all here, and because it's now time for action, right? It's true that a lot of organizations are talking about health as investment, WHO, UNGA, OECD, G20, G7, but we need now to foster the paradigm shift because there are other crises and other sectors try to also get financing, and we need to see and point out and create evidence why it makes sense to invest in health. And so the paradigm shift is, in my opinion, threefold. First, we need to convince that health isn't a cost, but an investment. I think we realized it quite well globally. Second, if we convince people and governments and stakeholders that health is investment, we need to provide evidence about the return on investment. Otherwise, we can't point out that it's smart to invest in health. And third, we need to convince global stakeholders that they have the opportunity to start a positive feedback loop by investing in health. We will come back to this a little bit later. You asked me how everything began. Actually, with my PhD thesis, I published it 2008, so 15 years ago, and the topic was the impacts of health investment to the German economy and to the German labor market. And this results I presented to the Ministry of Economic Affairs and Climate Change 15 years ago. And they decided that this is a smart idea and they want to have evidence how huge the sector health economy is in Germany. And a big thank you to the Ministry of Economic Affairs that they are funding this research work since more than 15 years. And they will update it. We have a contract up to 2026. So they continuously are reporting about the biggest sector in Germany. And so another big thank you is to the statistical authorities, especially the German statistical authorities, because they helped to provide data to build up on such a satellite account. And now we are providing this methodological approach globally. And that's really fantastic because it helps to point out what is the first step of the return on investment, because this is the economic and the employment effect.
Dennis, you just said that the health economy is the biggest sector in Germany. Can you just briefly give us a definition of the health economy? What is our picture or approach, and what do we understand when we talk about health economy?
Yes, thank you. So first of all, there are quite a lot of definitions, also life science and such things. And it's always talking about the definition. That's the most important part. And if we want to foster a paradigm shift that health is an investment and not a cost, then we should start with the health expenditures. And we translate the health expenditures into the sector categories where gross value added is created and jobs are created. So the health economy consists out of all the health expenditures, so hospitals, and we have inpatient care, and we have the health industry part, and we have also the payer side, insurance side, which is included into the health economy. And this definition is published and is used several times.
Okay, that seems to be, we also need a kind of new language to talk about health, because when I think about health, always seen as cost factors, you have all these silos within the healthcare system and stuff like that. So how can we foster this paradigm shift also with a new narrative? You spoke about GVA and employment contribution. Can you make it a little bit clearer what's important to see this macroeconomic figures also regarding the health economy?
Yes, we need to build up a narrative which resonates to different policymakers and not only to ministers of health. So we need to address ministries of economic affairs, of ministries of labor, ministries of finance, ministries of research and development. So we need to build up evidence to convince more stakeholders that it's smart to invest in health. And if you take one example, when the payer side in Germany or in some countries argue every year that they have to invest, that they have to spend in Germany 1 billion a day for health, the Ministry of Economic Affairs can say, with this 1 billion, we are creating more than 1 billion GVA, GDP contribution in Germany. And I think even for a non-economist, it's a smart investment if you're creating more than it costs, right?
Okay, we both are economists, so I think we need some evidence for our statement, and not only when we say they're really a contribution. You talk about this kind of return on investment metrics, and to foster this paradigm shift to measure this return on investment. Can you give us some insights why we are doing this and how we are doing this to measure the value of health investments directly?
Yes, because it's all about thinking about where to allocate budgets, right? And we need to think about in the mind of governments, of a minister of finance, should he invest in education, in infrastructure, or in health? And in all other sectors, you have certain evidence at hand, which you can argue why to invest there. And we need to create this kind of evidence for health. And it's not only theory, you can calculate it. And a big thank you to Rifat Atun from Harvard University. We presented, and Al Donnelly from the G20 partnership, we presented our ideas in the EU Parliament. And it's very simple. If you think about strategic reallocation of budgets, then you should measure for health. First, the cost of illnesses. You should allocate budgets concerning the cost of illnesses or the social burden. Second, you should allocate budgets where you create most of human capacity. That is so-called a societal value you're creating for the societies. And the third point is that you need to see health investments create a sector. And so this is the GVA and the health economic reporting we started 15 years ago. And these three layers are important, and this is our suggestion to focus on a health metrics measuring these three layers.
Okay, you are talking about reallocation. I think some Ministry of Treasure are really happy right now because you're not saying we need more money at the first hand. We need to invest the money we have in a more clever way to show all this. You just pointed out some steps of what we are called the value chain of health. So with a kind of prevention and stuff like that. And you spoke about the direct effects, the GVA contribution, and for the labor market. And when we are only point out the economic effects at this moment, there are kind of spillover effects that are not they're generated by the direct effects. Maybe you can say 2 or 3 sentences about this, what's the effect and why it's also important to measure not only the direct effect, but also the indirect and induced effects.
Yes, thank you. Yes, it's about the so-called spillover effects, right? And if you see health economy as a sector, and you try to compare it to automotive or to I don't know, infrastructure or other sectors, then you can either compare the direct effects, that's feasible now. But on the other hand, if you talk to the Automotive Association, they have at hand what 1 billion investment creates on jobs along the supply chain. How many GDP contribution is related to the 1 billion investment? These are arguments which are used in political discussions. And you can do the same for health as well. Then you see if you invest a couple of billion more in health, then you can see how many spillover effects concerning employment and concerning GDP contribution you are creating in certain countries.
Okay, then we have this kind of economic point of view, and with this matrices, we can show how the investment will pay off in the future or paid off in the past. You also talked about this paper with Riffard and Alan from the G20. If you can't measure it, you can't fix it. There, we pointed out a kind of 4 and now a 5-step approach to enlarge this economic point of view. Just give us some information. What's the 2 additional layer after that you also mentioned?
First of all, if you're talking about, and this was something I learned from our former Chancellor Angela Merkel when I presented her in an elevator speech, the results about the importance of private and public investments in health in Germany. In the end, she said to me, what does it mean? Should I invest more or less in health? And what does it mean to the society and to my voters? And this was kind of the birthday of measuring the societal value. Measuring the impact of investments to human capacity. We are facing labor market shortages in most of the European countries or in other countries. Think about this, if we wouldn't invest enough in health, what this would mean for productivity gains, right? And so we really need to take the social perspective into account. And what we are working on is, and you mentioned it before, that the interdependencies between health and climate change needs to be analyzed. And so we can measure what does it mean if we invest 1 billion in health compared to 1 billion in automotive for CO2 emissions, air pollution, and so on, so that you really position the sector in all the categories other sectors are dealing with.
Okay, that's really interesting and eye-opening, at least when you have this figure hand. I come to the facts and figures in a few moments, but let's see what we are facing right now. I would say it's a kind of exciting economic times we are in right now. So how do you see the health economy from your experience in this context, and what contribution can it make to economic policy in this volatile times now and maybe in the future?
I think great question. as I mentioned in the beginning, we are facing a lot of changes and challenges in the world. Global supply chains, crisis, in wars, it's really terrible, but we need to think about a strategic investment in the future, and health investment is a strategic investment for future growth, and therefore we need to convince policymakers, parliamentarians, that health investments stimulate all 4 determinants of the so-called magic square. It means first, it stimulates growth. Second, employment. Third, private and public investments create also surplus in exports. So it affects the trade balance. And fourth, something what nearly nobody thinks of, it also has an effect on price stability. Because, and we are facing high inflation rates in Europe and in Germany as well. I don't want to say invest more in health to fight against inflation. No. But it's a side effect, because if you want to fight against inflation, you need to increase productivity within your country. And we can measure that due to investments in health, productivity will increase. And this would fight against inflation. So, and if you then talk and point out that health investment stimulates all these 4 determinants, then you are one step further ahead to foster the paradigm shift.
Okay, that's really, really cool. Obviously, I have some advantages because I knew some of our figures regarding the health economy. When you talk about this magic square, think about the last decade. Let's start in Germany. We have few crises also facing the economy. What effect did the health economy have on our growth and employment? Let's start in Germany over the last decade.
In Germany, we had a golden decade, right? After the financial crisis in 2008-9, we had every time growth rates, right, over 10 years. And the health economy, we could provide evidence on this, created growth and employment during this time. So it was a stabilizer of economic growth. And now, even though that we are still investing enough in Germany in health, we are facing a recession. But now imagine what would happen if we would cut budgets in the healthcare system. And now I give one number. Up to today, 12% of the German GDP is related to private and public investments in health, 12%. And now think about a reduction by 10-20 billion, what this would mean for our entire economic growth or the recession, right? And this, so health investments stabilize economies globally. And that's not only in Germany.
Okay, what I've learned so far is health economy can help to stabilize the economy in times of crisis, economic crisis, but also can be a driver for growth and employment. So it has this double function for the economy. So you have this kind of positive impact on the economy in Germany. So we had talked a lot about Germany, and we said we do this calculation on behalf of the Ministry of Economic Affairs, which I think it's really interesting. It's not the Ministry of Health, but it's the Ministry of Economic Affairs. So we can point out health economy is an important sector in Germany. But let me guess, it's not only true for Germany, it could be also true for other regions in the world. So do you have some evidence for us to prove my question?
Yes, true. So first of all, during the last G7 presidency of Germany, the Ministry of Economic Affairs asked us to calculate numbers for the EU, right? And I presented this in the EU Parliament as well, that in the EU, private and public investments in health create a GDP contribution, which is equivalent to Spain and Estonia. It's around 11% in Europe, over all countries. And interestingly, the health expenditures in relation to GDP is 10.9. So we are in Europe, we are creating with €1 more GDP contribution than we have expenditures, right? So on a global scale, it's also very interesting. 7.6% of the global GDP is related to private and public health investments. That's 7.6 trillion, but it's easier. It's twice the GDP of France. Close to 200 million people are employed globally. This is the same, it's equivalent to the entire labor force of the US and Canada. So it's the biggest sector in the world, in most of the countries. I want to say there are a couple of Latin American countries we did analysis for as well. They are underinvested, right? It's for me, if you think about Mexico as a G20 country, they are investing close to 5.5% of their wealth in health. That's not enough. And other Latin American countries as well. So we need to analyze. In some countries we are investing enough, but not smart enough. And in some countries we really need to think about investing more in health. And at the UNGA side event, I mentioned that we should give incentives to countries to invest more in health. And maybe we can use blueprints from other sectors, right? If we are now talking about military service and defense, countries should invest 2% of their wealth in health. Why shouldn't low-income countries invest 2 up to 4% of their wealth in health? Middle income 6 to 8, and high income 10 plus. And the incentives should be that rating agencies take this into account, because we have seen due to the COVID-19 crisis that countries who are underinvested in health suffer longer in their prosperity than others. So it should be considered in the rating. And then the Ministry of Finance has kind of an issue, because if the rating gets down, the interest rates will increase and the refinancing of the debts will be more expensive. So maybe this can be a mechanism to think twice, investing more in health or not.
Okay, this is kind of a votum for Ursula von der Leyen called it a white deal in analogy to the Green Deal. So we need such initiatives on a global level. And you, in the beginning, you said now it's time for action. And with this matrices, we have some kind of evidence for this to prove this that. And what's just coming in my mind is when you talk about this incentives for investing, we have the SDG goals, which are really important and really good that we have this on a global level and have this understanding for this. But I think a quite huge problem is there is no figures within this where we can measure it. So do you think it would make sense to put this kind of metrics related to the SDG goals? And how many of the SDG goals, from your opinion, just a guess, are we affected when we're talking about health investments?
So some health determinants are in SDG goal 3, right? SDG goal 8 is about growth. 17 it's about connections. So yes, it's a smart idea. I think we need to provide evidence first, right? So that we show that it's measurable. And then you can give incentives. Why shouldn't development banks not finance health investments if they have a return on investment metrics behind, right? We know it's an issue because it's a middle to long-term investment. You sometimes see the return on investment not immediately in 1 year. So you need to think about an evidence about 3, 4, 5 years or a decade. And so the biggest topic is, if we foster the paradigm shift that health isn't a cost but investment, we provide the evidence that it's that you can measure the return on investment over a period of time. Then the third question is who can finance it, and who will invest in private-public health investments. That needs to be a team. So private investment, public investment, and that guides me to one aspect I want to mention, because in the beginning I mentioned this is the paradigm shift is threefold. It's about the positive feedback loop, and that's something which resonates. This concept resonates very good in political discussions, because you need to convince them if they invest smart in health. Smart investment is usually investing in innovation, digitalization, in product innovation, in process innovation, in system innovation. We can give evidence how these investments create better health in terms of human capacity, in terms of productivity. If we have a more productive society, then we can face the labor market shortages better. We will create greater wealth. Greater wealth for the countries creates more fiscal space. And with the fiscal space, we can invest again in innovation. And then we start a positive feedback loop, which should be the concept in mind if you're talking about investments in health and return on investment.
Perfect. Thanks for clarifying this again, Dennis, because our focus right now was the economic point of view of the health economy, which I think it's really important to have this evidence ahead to show how the investment will pay off when it is. But as you mentioned right now, with this kind of positive feedback loop, as well as the value chain of health, that's in the end, the health is the most important part we are talking about. And we are all doing to get a better health system and to get a better health for the society and for every one of us. So before handing over to our Q&A session, I would like to end with a kind of classic, Dennis. Imagine right now you're in a room and you have all the global stakeholders at one table. And you just pointed out there are 3 steps to force this paradigm shift and to get involved, to trigger the positive feedback loop and stuff like that. But when you have now the chance, everyone is there and you have 3 wishes or points or whatever, what was your recommendation, concrete next steps to shape the health economy in the coming years, so it's not only the biggest sector in a country, so it's also providing health and better health for all over the world? So what would the 3 wishes or recommendation would be?
First, reallocate budgets step by step concerning the highest cost of illnesses or the highest social burden. In some countries, already cancer is has the highest cost of illnesses and the highest death rates compared to cardiovascular diseases. So it's not in all countries cardiovascular diseases. But if you would try to allocate more money in prevention, early diagnostics within cardiovascular diseases and in cancer, you would, in the future, you can save up so much money, which you can also reinvest again. So this is the understanding. Second, they need to analyze for themselves if they invest smart and good, and so they need to work on this evidence. That would be my second recommendation. And the third one is convince do partnerships and see health as a value chain of healthcare and try to break silos due to this evidence, because this is an issue, right? Everyone is screaming for budgets in silos, but nobody sees the entire holistic picture, what needs to be done.
Okay, that's really great. Thank you for this first wrap up, Dennis. So let me just check the chat or FAQs for our first question. So, Dennis, let's start with the question. Who are the key stakeholders in sustainable financing healthcare system? One of our attendees wants to know.
The key stakeholders first are, I think we need to think in private-public partnerships, right? If we're talking about investments, if we're talking about innovation, to embed digitalization, to make the healthcare systems more efficient, we need to think about a health industry which is a backbone of an efficient healthcare system. So we really need to take everyone on one table. And actually, for me, it was the COVID pandemic crisis, a kind of a blueprint. Stakeholders worked very close together. They accelerated processes because they had a common goal to fight against COVID-19. And maybe we should also try to convince more stakeholders. That was the reason why I say it's not about talking to HTA bodies or to ministries of health or the entire health consortium. It's more about finding supporters next to the Ministry of Health for the idea to invest smart in health.
Okay, perfect. I think the next question fits quite good in this. Someone is asking, financial institutions have longer time horizons than governments. How could we engage with those stakeholders and what would be relevant for them to embrace this way of thinking? For example, return on invest in healthcare sector.
So when I got the question right, it's true we have the issue about the elections. So I learned from Riffert again, if you start with a project, it must be over the election period of time, right? Such projects need to be installed for more years so that there is a certain consistency in doing this exercise. I think, yes, financial institutions, they have the middle to long-term aspect. I think maybe it would, and that's what we are trying to discuss with them, if you really can provide evidence to them, what happens with what is a return on investment? And these are the words they are keen on. They want to have a return on investment. So that, and you need to provide an evidence which is robust to give them a result after a certain period of time. And then I think that they would think twice where to invest, right? If the return on investment is high, and I guess it's high because you have the impact on GDP, you have the impact on human capacity, and you have in the end a reduction of cost of illnesses, which saves up money in the end. And these are the categories of the return on investment. I think the next big step is to convince them or elaborate together with them a matrix, a robust matrix, which is a certain standard in the future.
Yeah, it reminds me a little bit of the discussion over decades ago regarding the invest in education. So I think we have to come to this point of view. So Dennis, looking at our remaining time, I've got two more questions for you, which are really interesting. The first one is, what advice would you give to female founders and investing in female healthcare? It's a really underserved sector.
Absolutely. And I'm so happy and proud that the women's health is a huge topic, yet also in G20. So that this topic that needs to be tackled, all right? We need to think about, if we talk about smart investment, also in which kind of areas concerning women's health. Take as an example breast cancer, right? In other disease areas where we really need to focus on. And we need to find low-hanging fruits to provide better health with low costs, right? And early diagnostics and so on can save up money in the end. So women's health is a really huge topic. And yes, I give also lectures for entrepreneurs. And I see, unfortunately, that not a lot of women found companies. I don't know why, or it's unfortunately not the case, and hopefully we can support or give advices how to do it and where to do it.
So we have to talk more about the opportunities and chances we have in this sector for female founders as well as for female health.
Yes.
So let's end with this question, quite interesting one. What is the biggest pushback or argument on investing in preventive care when the evidence is clear? Because it is only proven at the macro level and difficult to prove at the treatment level.
It was an interesting discussion also in a couple of weeks ago, that some politicians don't trust the evidence about prevention, right? And there are so many reports published that investment in prevention really creates a return on investment. So maybe the trust can be one case, because sometimes I have the feeling, if we talk with companies out of the health industry, they should invest more time in trust building. They should create evidence how they can support, that they are not a problem, but that they are part of the solution. And that was the reason why I mentioned before that, in my opinion, the health industry is the backbone of an efficient healthcare system. So, and think the health industry needs to build up a narrative around this, not negotiating prices, but pointing out how can they be part of the solution to prevent cardiovascular diseases, to prevent cancer, and so on. And this is trust building. And I hope that we can support a lot of companies and associations to build this trust with a robust evidence.
Okay, there we are again at this kind of maybe another positive feedback loop and a positive narrative to go to this kind of maybe big issues for the future, but we shouldn't be afraid when we have kind of metrics to show the return on invest, to show it's smart to invest, and to get more into the broader picture of health. You pointed out with our health economy, we have talked about a little bit about women health and stuff like that. There are a lot of really interesting topics and issues we could talk about much more, but hopefully we will have another round in our LinkedIn webinar. Maybe we can focus on women health or something other interesting topic. And I would say one of the most important sentences regarding this topic, but also some other topics maybe, is our positive slogan we had from our G20 paper: only if you measure it, you can shape it. And I think we have a lot to shape, and it's really interesting to shape the future for health for all of us. And yeah, thank you, Dennis, for this for me interesting 40 minutes with you again to talk about our topic, health and health investment. And a big thank you to all our participants. And I would say I hand over to Danny to close up our session.
Thank you so much, Sandra, for your questions, and it was fun talking to you.
Guys, brilliant. Thank you both of you so much. And there definitely will be a next round, so keep your eyes peeled for that. Very exciting. It should be in the start of the new year. Thank you all for attending. I hope you found it as interesting as I found it. We will be in touch with both answers to the questions we didn't manage to provide answers to. We will also provide the recording for those of you who attended. And if you are interested in WifOR's health research or WifOR's research in general, please do check out our website or get in touch with us via dialogue@wifor.com. I wish you all a lovely afternoon or morning, depending on where you're dialing in from, and we will see each other next time. Goodbye, everyone.